Okay. Um, we will go ahead and get started. Thank you to everyone who has hopped on. Um, my name is Mary Frances Charlton, and I am the youth health attorney with the Chicago Coalition for the Homeless. And while my practice area varies and I work on things other than public benefits, my primary focus is public benefits, and that has been the case for most of my career. So I'm always excited when there is enthusiasm about public benefits and making sure that people who need these benefits are connected to them, particularly people experiencing homelessness. So just a couple of housekeeping things before we get moving. Throughout the presentation, my colleague Claire is going to be monitoring the questions. So if you have any questions, drop those in the Q&A and I'll answer those at the end. And this presentation will be sent out to all the folks who registered. So if you, and Claire can correct me if I'm wrong, but if you registered using the Zoom link, you should get a copy of this presentation, which will be useful because I've included in my presentation some links that you'll only be able to access by actually having the presentation. So look out for that. That'll be in your inboxes shortly. So with that, let's dive right in. So I do want to just make clear from the outset that this is going to be about a 45-minute presentation. So there is no way on earth that I could get through every public benefit that is available to folks in Illinois in that amount of time. And not only that, but I can't even get into the full nitty gritty of these programs in that amount of time. So this is going to be a pretty high level overview. However, one thing that I want you to leave here with, particularly if there are folks on the call who work with people experiencing homelessness, work with homeless youth, or who are themselves experiencing homelessness, I want you to understand that you can reach out to me after this presentation if there is a question that is deeper than what I cover here, and I will include my contact information at the end of the presentation. The benefits I will be covering are SNAP, Medicaid, Tanf, and disability. There are more benefits out there, but these are kind of the bread and butter benefits that most folks have heard of. And so I want to highlight some of the details of these programs. So the first one is SNAP, and this is nutritional assistance or food assistance. And sometimes it's referred to as LINK or food stamps, but the current name for this program is the Supplemental Nutritional Assistance Program. And it, like many other public benefits, is administered through the Illinois Department of Human Services, which I'll call IDHS throughout the presentation. These benefits are, for folks who qualify, loaded onto a LINK card every month. And you can see on the side here a picture of what that card looks like. It is almost indistinguishable from just a credit or debit card. And it is, like I said, a monthly benefit. There are limitations to SNAP. First of all, in my opinion, and that of many advocates and certainly folks who receive SNAP benefits, it's really not enough of a benefit to feed oneself or one's family, even if you get the maximum amount. The maximum monthly SNAP benefit really only will pay for less than $2 per meal, which is clearly not enough. We think that those benefits should be increased, but for now, it very much is like what its name is. It's supplemental. It won't actually provide enough money to really stay healthy and not be hungry. There are limitations on what these benefits can buy. So it can't be used to, there are a lot of misconceptions out there. There are a lot of limitations on these benefits. It can't be used to buy things that aren't food, like alcohol and tobacco. It can't buy even essential non-food items, like toiletries, even if they're sold at a grocery store. Everything has to be food. And even within that category, folks can't buy like pre-prepared hot meals at the moment. Now, Illinois, in recent years, passed what's called the restaurant meals program, and that will eventually, when it's implemented, allow SNAP benefits to be spent on restaurant meals at participating restaurants. However, that has not been implemented yet, and CCH and other community organizations are working with IDHS on the implementation of that program. So we look forward to that, because particularly for people experiencing homelessness, if you are, without a way to cook or a way to store food, then obviously having that food doesn't do you much good. So this will be a big difference for people experiencing homelessness in particular. And then as part of the SNAP application process, it's very important to know what comprises a SNAP household, because if you are in a SNAP household with other people, those other household members' income has to be counted toward your SNAP application, which can lead to the monthly SNAP benefit being reduced. So this is, important to understand, because people who live together, even if they aren't related, even if they aren't partners, have to be in the same household if they both live together and regularly purchase and prepare meals together. So this includes a lot of folks who are living doubled up for any extended amount of time. Like I said, even if they're unrelated, if you're living with someone and purchasing and preparing food together, then you have to be on the same SNAP application. One issue that frequently comes up in the context of the folks that I work with, because I primarily work with youth, is that if a person is under the age of 22, they're presumed to be in a household with their parents. So a lot of times you'll see someone who used to be on their mom's SNAP account, and they are out living on their own, unstably housed, and they go and apply at IDHS, and IDHS has in their system, well, you're under 22, so you're already in a SNAP household, and they get denied. So it's important to flesh that out when you're applying, or if you're helping someone else a young person apply for benefits for themselves. And just to briefly touch on eligibility for SNAP benefits, the currently eligibility is capped at 165% of the federal poverty level. And that alone can kind of be hard to understand. What does that mean? Well, at the moment, the federal poverty level changes on an annual basis, but right now, just to give you some perspective, I have here a household of one is almost $13,000 a year for income, and a household of three is almost $22,000 a year to meet that 165% of the poverty level. Now, benefits they vary even in the, between the 0% and 165% range of the poverty level. Benefits are going to be less as you get higher up on that scale. So if you qualify for the maximum amount, ordinarily you're going to get or you're going to get $194 a month in SNAP benefits, unless you have an overpayment on your record or something and the agency is deducting part of it. Now, and that's for a household of one. The more people in your house, the higher your benefit level will be. Now, as a result of the response to the COVID-19 crisis, there have been some changes to help people get through this, both public health and economic crisis, and the recognition that people need more benefits in order to get through this. So this was recently extended in an executive order signed by President Biden. But currently, every qualifying household, even if you're close to that 165%, where you would usually get like $16 a month in SNAP, if you qualify for even $1 of SNAP, you get the maximum SNAP benefit during this crisis. And thanks to that executive order, households will also begin getting a 15% bump on top of that. And finally, another COVID-19 change is that school children who have been remote learning, who ordinarily would receive subsidized, so free or reduced price lunches, are eligible for something called pandemic EBT, or PEBT is what we refer to it as for short. This program has essentially a lot of folks might remember back in the early days of the pandemic, these benefits were applied to folks' link cards automatically if they were already getting SNAP, or families could apply for it if they weren't already getting SNAP. After that, first semester of school ended, things kind of went sideways. And while the program still exists, Illinois and other states had to go through the federal government to get their plans for administering the next round of PEBT approved. Illinois has had its PEBT plan approved, but they're still finalizing things before those benefits become are distributed again. So those people are not currently seeing those benefits, though hopefully they will soon. I also want to touch on the processing times for these applications. A SNAP application, IDHS must act on someone's SNAP application within 30 days, no matter what their circumstances are if they apply. However, for certain groups, and this is often going to include people experiencing homelessness, there is an expedited processing deadline. So if you have less than a certain amount of money in your bank account, they have to process it within 5 days. If your rent exceeds your income per month, they have to process it within 5 days. Now that's a really quick turnaround time. So it is important that if you're a provider helping someone apply, that you keep that in mind. And if it's looking like it's taking longer than that, do get in touch with me, because I can help hopefully get that moving. And so another item I want to touch on on SNAP before I move on to Medicaid is college student eligibility. So four-year college students are broadly ineligible for SNAP benefits. This is something that is unfortunate and is really based on racist and classist assumptions about who was in college. So college students, it's very hard to get SNAP benefits. But kind of the most common way that I work with my clients who are in four-year colleges to get SNAP benefits is to help them apply for one of these exceptions. So I have them listed here. I won't go, we don't really have time to cover each one in detail. But I do want to highlight one of them, which is work study. This is probably the most common because they don't have to be in work study 20 hours a week. That's a lot of working time for someone who's a full-time student, 20 hours a week. So the work study route is kind of often the best way to get into one of these exceptions for college students. However, again, COVID-19 has really made this a challenge because a lot of people's work study has been canceled due to the pandemic. So it's been harder under the pandemic to get people who are enrolled in a four-year institution SNAP benefits. Now, the good news, I like to end the topic on good news if possible, is that CCH and other advocates worked really hard to get the community college student rule passed a couple of years ago. So since January of 2018, if a community college student, so a two-year college student, is income eligible for SNAP otherwise, they don't have to meet one of these exceptions. They qualify for SNAP benefits. And this is a link that I have that I think you'll find useful, especially if you're working with young people, is we have on our website the verification form that must be signed by a school administrator in order to present that to IDHS to get these students enrolled in SNAP. This is a newish rule and it's sort of complicated. And, one element of it that I failed to mention is that in order to qualify under this rule, the student has to be enrolled in a Perkins approved course of study. That encompasses most traditional courses of study. It rarely will fall outside of a Perkins approved course if you're in a community college. However, the local IDHS office does have to verify that. So you do have to jump through some hoops in order to make that happen. And because it's a newer rule, not every caseworker is implementing it because you're so used to saying, oh, college student, they don't qualify. Okay. And I am just going to try to cruise through this because I could nerd out about this stuff so long that I'm sort of, I don't want to spend too much time on any one topic. So Medicaid. This is free or usually free, but occasionally there will be some cost sharing, which I'll go through in a minute. But it's generally speaking a free health insurance program that is jointly administered by the state and the federal government. And it covers a wide range of services, even services that have traditionally been left out of a lot of healthcare coverage, like mental health, dental, and vision. The eligibility is going to depend on which Medicaid category you fall into. Medicaid is sort of a patchwork along with the Affordable Care Act of state and federal healthcare programs that hopefully everyone can fall into at least one of these buckets. But as part of the Affordable Care Act, Medicaid, which a lot of people will remember, in the bad old days, Medicaid was really just limited to people who were older, like retirement age, and people who had a disability, and children and pregnant women. The Affordable Care Act came along and expanded Medicaid to all low-income adults in states that chose to participate, which Illinois is one of those states. The asset limit, there's no asset limit for just standard ACA coverage. And the monthly income goes up to 133% of the federal poverty level, which is just a little bit over $13,000 a year for a single person. So that program probably has the fewest rules that you have to parse through. Children and people who are pregnant are covered by moms and babies / Medicaid presumptive eligibility for pregnant folks. And for that program, there's no asset limit, and you can have a monthly income of up to a little over twice the poverty level. All kids is a bit more complicated as to eligibility. So there's no asset limit for either of these programs. And all kids coverage goes, and this is for children under the age of 19, it goes up pretty higher than most public benefits programs in the income category, up to 318%. But coverage varies. There are tiers of coverage, and people with higher income levels within those tiers, up to 318%, might have copays or a monthly premium. But for low income, like the lowest income children, or children in the lowest income household, I should say, that don't have any cost sharing or premium. So coverage is free. And then finally, probably the most complicated program of, well, second most complicated after long-term care, which I'm not going to cover today, is ABD Medicaid, so age, blind, and disabled. There are asset limits to that. So there's limits on how much cash people have access to in order to qualify for that program. And it's $2,000 a month for a single person, which is just, these limits need to be changed to reflect our current economic situation. But and then I do want to mention a couple of other issues about Medicaid. So Medicaid is while it's run through HFS, a different state agency, just like SNAP and just like Tanf, which I'll cover next, eligibility is determined by IDHS. And in fact, SNAP, Medicaid, and Tanf are all on the same application. And like in most states, our Medicaid plans it's not like you just go to the doctor and Medicaid is reimbursing them. Most plans in Illinois are managed through a managed care company. And so the day-to-day work of like covering, determining what is covered and how doctors and providers are paid is through a managed care company, which is essentially a private health insurance like company. And often it's Blue Cross Blue Shield is just one managed care company in Illinois that manages people's Medicaid plans. And each Medicaid beneficiary can choose in most cases, can choose their managed care provider. A few just other random considerations. Medicaid versus Medicare. I don't want to belabor this, but they're inconveniently very similar sounding, but Medicare is a different program. It's run through Social Security. It's a federal program that you get if you're retired or get a certain type of disability, which I'll cover at the end here. The Affordable Care Act, like I said, the ACA expanded Medicaid to childless low-income adults. However, there's also the Affordable Care Act marketplace. Most of the people I work with as a lawyer qualify for Medicaid, so I don't spend a lot of time doing marketplace enrollment or assessing people's eligibility under the marketplace. But the marketplace, healthcare.gov, which I have linked here, established by the Affordable Care Act and allows people to go on, sign up for a private health insurance plan that they receive a subsidy to pay for their monthly premium through the federal government. Long-term care Medicaid, that is for people who require help with activities of daily living. So, nursing home level care, or you need an at-home aid to help they do things like get dressed and make food and that sort of thing. And eligibility for that is really complicated. But it's good that you know that it exists. And then medical transportation, people who get Medicaid can get help getting to their doctor's appointments. I have a link to the website that you can go to start that process of setting up your transportation to an appointment. I recommend doing this at least 5 days in advance. And obviously this doesn't help much if there's a medical emergency. Clearly don't delay, getting transported to the doctor's office, just because it's too close to sign up for transportation. But generally speaking, if you know an appointment is happening, you should call them 5 or 6 days in advance. And finally, with Medicaid, coverage goes retroactive 3 months from the date that you apply. So let's say that a person is uninsured, though they would qualify for Medicaid, and they have an accident and an unexpected gigantic medical bill. They can actually go and apply for Medicaid at any time 3 months after that, and it will retroactively cover that bill if they've gone to a Medicaid provider, which, like, major hospitals in this area are going to be Medicaid providers. So that's good to know. Don't let 3 months pass without getting that retroactive coverage. I thought that was the end of Medicaid, but I'll just really briefly touch on this. So there are, like SNAP, there are rules around who has to be in a household, in a Medicaid household. So generally speaking, this comes up most commonly with a young person under the age of 19 who's living with a blood-related caretaker relative. So this could be mom, dad, aunt, uncle, whoever the person is living with. They are required to be on their caretaker's application unless, they are required to be on their caretaker's application, but I often see unaccompanied homeless youth who have trouble applying on their own because of this rule. And again, what IDHS is seeing on their end is that they already have a Medicaid household. So you just have to make sure that they're made aware that this youth is unaccompanied. And I, just in the interest of time, take a look at this slide later. Again, these slides will be going out, but these are examples of problems that come up when youth are applying for Medicaid. If they're, youth who are experiencing homelessness are applying for Medicaid. Okay, TANF. So TANF is cash assistance, and this program is honestly very limited, which is truly unfortunate because oftentimes what people need most is cash. And, a lot of you on the call might have been stricken by what strikes me about SNAP is that it's really patronizing in that it tells people what they can and can't spend their money that they're eligible for on. TANF does not have those limitations, and trust, people who are getting cash assistance are trusted to know what's best for their family and how to spend that money. Unfortunately, it's a very limited program. It's literally time limited. The acronym stands for Temporary Assistance for Needy Families. And there's a lifetime limit, which I'll go over in the next slide, on the number of months you can receive TANF. But this also has other eligibility criteria. So this is only for people who are pregnant or caring or caring for a child. You have to be in Illinois or qualify as either U.S. citizen or meet a qualifying immigration status. One of the biggest things, I would say probably the second biggest limitation of TANF after the lifetime limit, is that there are really onerous work requirements that come with TANF. So this, the cash assistance program was really eroded by quote unquote welfare reform in the 1990s, and is, as a result, something that not a lot of people, compared to the amount of people who likely need this benefit, not a lot of people are able to participate in this program. So currently the benefit level of TANF, and this is going to get sort of wonky, so bear with me, is 30% of the federal poverty level. So in other words, the cash amount that a household receives is 30% of the federal poverty level. This is, so in Illinois, and this is an Illinois thing, the percentage varies from state to state. CCH and Heartland Alliance recently worked together with some other agencies to pass a bill in the General Assembly, which raised the monthly benefit level to 30%. So for a household of two, that's a little over $430. And that changes on an annual basis because the federal poverty level changes on an annual basis. The other issue is if you're working and receiving income, the TANF benefit is reduced. And IDHS has a formula that they use that I won't belabor, but often the amount of hours that people are working to comply with the TANF work requirement leads them to basically their work hours subsume their TANF, so they don't really get much, if any, in the way of TANF benefits. Like I alluded to earlier, TANF has a lifetime 60-month limit. That's 5 years. And, but I will say there are exceptions to that. So if someone is getting SSI, if they're disabled, they don't have to, they don't have the lifetime limit. And there's a way that you can also exempt individual months. If, and like I said, I can't go I wish I could go in depth on this, but the takeaway point is if you have a situation where someone's TANF is getting cut off and it seems like something unfair happened, reach out to me, refer your client to me, and I can help them workshop it or file an appeal or work with IDHS to fix the problem, if there is one. Okay, disability. We're on our last benefit of the day, and I want to leave time for questions. So I'm going to try to go through this quickly while not sacrificing any crucial information. So disability, you see this is in red, and it's because it comes up so much. And I see a lot of people who get disappointed because they've kind of been made to believe that they might qualify for disability, but they don't. So the person doesn't just have a physical disability or mental disability to qualify for these benefits. They also have to prove to an agency that really doesn't want them to get these benefits that they can't work because of their disability. They can't work because of their disability. It's hard to prove that even under the best of circumstances, but at the same time, this benefit is so important to people and gives people a steady monthly income, which is invaluable when people are searching for housing and that sort of thing. So it's hard to get, but it's really important. The final thing that I always harp on is that it's almost impossible to get these benefits if you're not currently being treated for the condition that is preventing the person from working is not being treated and that they're not complying with the treatment. And again, like back in the day, it was really hard because people didn't always even have health insurance to get their, disability, get treatment for whatever was making it so that they couldn't work, which was a vicious cycle because of lack of Medicaid expansion. So that has been improved a bit after the ACA, but still it's a problem. So the different types of disability are SSI, SSDI, and survivor's benefits. There's more to it than that, but these are the main three programs. So SSI is what I see with my clients most commonly qualifying for, and that is a disability benefit for people who have little to no work history. SSDI is if the person has worked enough years and paid had those deductions taken out of paychecks for enough years that they qualify for this payment through Social Security that they've paid into. Now, those differences are kind of like, I would say the most important difference is that SSI is less, you'd rather be on SSDI. And this is because SSI has resource limits, whereas SSDI does not. Oftentimes you get a higher monthly benefit with SSDI, though not always. But, SSI, if the person doesn't have a work history, it's good to have that. And it also, SSI makes you categorically eligible for Medicaid. So you're always going to have Medicaid as long as you have SSI. SSDI, there's a waiting period, but folks that have SSDI will eventually qualify for Medicare. Another issue that I see really, really often is the fact that someone, when they were a minor, got SSI and are cut off that benefit as an adult. It's important to know that just because someone qualifies for SSI as a minor doesn't mean they will still qualify as an adult, which is really weird and leads to a lot of disappointment. So at child SSI is easier to qualify. You just have to demonstrate that there's a physical or mental condition that seriously limits your activities, and that condition will last for at least a year. Adult SSI, you have to prove that you have one of these conditions, but that it also prevents you from engaging in this term of art called substantial gainful activity, which basically means that you can't earn a certain amount of money per month due to the disability because you can't work. And that is expected to last for at least a year. And that's hard to prove. I find often that the hardest thing to prove is that in these cases is that the person can't work, because even if it's clear as day that they can't work and they're telling me that they cannot work, the agency often will say, okay, well, you might not be able to do this job, but you could do this, desk work basically. Well, that's often not true either. And it's really hard to prove to the agency that someone can't work. And it's increasingly so. It used to be, it is recently a lot harder to qualify for disability of any type. And like I said, I guess I'm saying it twice because I see it so often and because it so often prevents people from getting benefits. The person really has to be receiving treatment for whatever the condition is that it prevents them from working. And it has to be consistent treatment. The longer they've been receiving treatment, the better. And they have to really demonstrate that they're complying with their treatment plan. Again, all of this is really can be condescending and unfortunate, but this is the world we live in with these benefits. So I try to just hammer that home. And I'll end with this before I take a couple of questions. I just have a list here and I have links so that you'll have when you get this via email, the way to apply for these benefits. So for SNAP, Medicaid, and Tanf, I accidentally put on the PowerPoint SSI on this part up here. Ignore that. For SNAP, Medicaid, and Tanf, you apply through IDHS, and I have a link here to ABE, which is the online application for SNAP, Medicaid, and TANF. If that doesn't work, because sometimes people can't do it that way because there are kind of weird ID proofing issues, then under normal times, you can go to your local family community resource center. I have linked here a map to those. A lot of them are closed, so check ahead due to COVID, not all of them, but check ahead of time to make sure that that isn't the case before you go. Or you can call this number here that I have listed. For SSI, SSDI, that is through the Social Security Administration, not through IDHS. It's a fully federal program. So I have the number to call. I I resort to this a lot nowadays because the local offices are closed. So I'll often set up, call this 1-800 number to set up a phone appointment with our local office when I'm helping someone apply for SSI. And then if someone is denied Social Security, that one you would refer to me because I can assess whether it's a good case for an appeal. And that's it. If anyone has questions, I know Claire's been monitoring the Q&A, but I do want to link my my contact information here, so you can write this down or wait to get this in your email inbox.
Yeah, so we've received several questions. One of them was about how to apply or how to help people apply when the public aid offices are closed. And I think you just answered that on the last slide with all of the website information and phone numbers. Another question we received for the PEBT, will there be back pay since it was approved but not yet distributed?
Yes, you should get back benefits for the months where it was approved but hasn't been distributed.
Okay, and are folks automatically assigned if they do not choose their managed care provider?
Yes, good question. That's right. So you're not just kicked out of Medicaid, you automatically get put in a plan. And you can change that plan. And actually, in one of the slides, there's a link to the website where you can manage the plan.
Great. And if you are homeless, would you qualify even if you don't have an address? If you become homeless, does your SNAP benefit decrease?
Great questions. The answer is that yes, you can still apply even if you don't have an address. And no, your benefits do not decrease because you become homeless.
Okay. And is there any help with utilities available?
Yes, there is the CEDA program. Of course, the acronym, I don't know what it stands for, but if you just Google CEDA Illinois, you should be able to pull out that application. And there's an application process, but it's not too bad. The person has to fill out like an affidavit that their utilities have been disconnected, but there is utility assistance, yes.
And for students who are alone, not living with anyone, and have received an STLS letter, can they have SNAP during their college years?
Well, unfortunately, that's going to depend on if they still would have to meet one of those exceptions. There's no exception just for, being homeless on its own. But definitely, if someone is in that category, refer them to me and I can help them workshop that, because oftentimes they will meet one of the other exceptions.
Okay, and this question comes from someone who has a parent that was recently in a car accident. She has little to no work history and is unable to work. Can she get SSI and Tanf? She is unable to walk due to a broken femur and shattered wrist.
Well, A, I'm sorry to hear about that. That sounds awful. B, she might be able to get SSI, but remember the condition would have to be expected to last for at least 12 months. So probably not just for that issue. The place that she works, you should talk to her HR. I can't remember. I think you might have said, I can't remember if you said that she was working. But there are employers will often have private disability insurance plans, not all of them, but some of them do. As far as TANF goes, if she is parenting and hasn't used her 60 months and, she might be the difficulty. So the months that she's not able to work might be able to be, depending on her exact circumstances, she might be able to get those exempted under the exceptions for disability. But, she might also be able to comply with the TANF work requirements by doing certain job search activities and that sort of thing. So that's another one. Feel free to email me for individual case questions like that, and I can help you work through it or help your client.
This question is, what is the age that child SSI cuts off, 18 or 21? Survivors benefits last over age 18 if the young person is continuously enrolled in school, correct? And what about over age 21?
Okay, so that one, the benefits cut off at, when the person turns 18. And what were the second two questions?
Survivors benefits, do they continue over age 18 if the young person is continuously enrolled in school?
The survivors benefits?
Yeah.
No. Those go up to 19, I believe. And they are only for people under that age. But if they're 18, they have to be enrolled in school full time.
Okay.
And actually for any age, they have to be enrolled in school full time.
And do foster families qualify for the PEBT?
Yes, it would be the SNAP household that would qualify. So that would be foster families if they're living together and preparing food together.
And someone said they have a student whose mother is going blind and doesn't know where to start. Do you have any recommendation for them?
They should. So, blindness is its own category in disability benefits. So they should talk to the Social Security Administration, using one of the links I provided in the presentation to get that process started.
Okay. And did you say that the SSA offices are closed? Is that all offices?
Last I checked, yes, which makes things really difficult. Actually, less so for disability, because disability was always so difficult to begin with. But I feel like what I've had most trouble with under these circumstances is just the simple act of getting someone their Social Security card. But yeah, it's been really frustrating having those offices closed. But of course, we understand, we got to keep everyone safe. But in the meantime, it's hard for folks who need those services.
And do you know the months PEBT was approved?
Not off the top of my head, because there was a big gap. So during the times when, and I can get you a firm answer on this, but a good way to think about it, and I also don't have kids in school, so it's that much harder for me to think of it, but it's during the months only that students would otherwise be in school. So it's been approved for like the spring that the pandemic started, then there was a break over the summer, and then the fall. I think that's the last I know that it was approved. I want to say that it's been approved for this spring semester, but if there's a way to send follow-up answers to the group, I can do that later.
Okay, and do you know of any resources for families who cannot pay for burial fees?
So I recently dealt with this situation, and there's actually a program through the Illinois Department of the IDHS, same office that administers SNAP and Medicaid. But it's a little complicated, and it is only for people who are shouldering the funeral expenses for people that they wouldn't otherwise be legally responsible for. So, people, it's the person who I worked with, it was her mother-in-law or something. And so she qualified because, she wouldn't have really been legally required to do that, but was essentially volunteering to do it. So it's sort of limited.
And in regards to SNAP benefits, should individuals that live in the home but immigrated to the US recently be counted in the application if they share a meal?
That is a great question. The answer is yes, they should. However, they don't have to provide any information if they're worried about giving that information over to IDHS. They don't have to provide any information, but their income has to be in the household. And SNAP eligibility is more it's more wide ranging than you would think it would be, as far as like in Illinois, the rule recently changed somewhat. I guess it's been like a couple years at this point, but if you even are planning to apply for asylum, you can get SNAP, even if that you don't have any other documentation. You know, if I usually tell people go ahead and start the asylum application so that we can give something to IDHS, but it's like, you know, more people qualify than you might think. But talk to me first with like, because I definitely want to, you know, be careful about giving people advice around, because immigration can have such wide ranging consequences. There was also like the public charge rule, which I believe, I mean, I think that that's near the top of the list for the Biden administration to undo. So hopefully that won't be a concern soon. But, you know, definitely if you're worried about the immigration side of things, reach out to me and I can help you work through that.
I think that was all the questions, unless anyone has any last minute questions they want to send in the chat or the Q&A.
Yeah, and anyone can reach out to me after the presentation too. You know, you have my contact information now, so feel free to use it.
Okay, I think that's it.
Yay, thanks everyone.